Good evening, everybody. We're going to start our uh, review of the neurologic system in regard to the function in children. Okay, the development of the nervous system in children. Um, it develops in the embryonic ectoderm in different stages. And there's rapid development of the brain during the third, fourth, and fifth gestational months. You have the formation of the neural tube, development of the forebrain, neuron proliferation and migration, formation of synapses, and myelinization. All of those things are taking place. So that's one of the reasons it's so critical that especially during that first trimester that they stay away from anything that can cause ultimate issues because if they have a history of neural tube defects, this is when it's going to happen. That neural tube isn't going to close as it's supposed to. Okay, so the development of the nervous system in children, you have fontanelles, one in the front and the back. Those are spaces between the skull that allows growth, brain growth. In head growth, you have hydrocephalus. Sometimes those are babies born with large heads. Typically, it is an issue with fluid not shunting from the brain. And you have microcephaly. Microcephaly can be caused by an autosomal recessive gene. It can also be caused by illnesses like the Zika virus. Reflex responses. Babies are born with all sorts of reflexes and they disappear in a predictable order. So with all of the reflexes that they're born with, the stepping is the first reflex that's going to disappear. They suck, they grasp, they step. All of those things are normal reflexes that babies are born with. It's a protective mechanism for survival, and those disappear as they get older. Okay. So here is a photograph of the suture. So you can see that the brain is in pieces. It's not a solid piece in infants. And you have the anterior fontanelle here and the posterior fontanelle here. The posterior fontanelle closes the fastest, and it can take upwards of 9 months for these fontanelles to close. And these skulls, the skull of a newborn is segmented, so it isn't fused. These pieces of bone are not fused, and that's incredibly important. If a child is born with fused skull, they actually have to go in and be surgically separated, and I have known patients that have had that done. So that's an important aspect in. Okay, here are some structural malformations that are related to neural tube defects. So when the baby is in utero and developing, if there are issues with the neural tube, it doesn't close, different malformations can occur. Anterior midline defects are cyclopia, and this is an example of an infant born with cyclopia. It's very uncommon. In all my years of women's health, when I was in women's health, I only ever saw one case of it. But the eye is central. Typically, there's just one. Spina bifida, anencephaly, which is a baby born without a brain, just a brain stem, and xenophil, meningocele, myelomeningocele is a hernial protrusion of a sac-like cyst through a defect in the posterior arch of a vertebrae. So you can see that in this picture here. Now let's talk a little more depth, neural tube defects. Spina bifida occulta. The vertebral defect, it's not visible. There is no neurologic dysfunction, and the spinal cord and nerves function normally. Craniosynostosis is a premature closure of one or more of the cranial sutures. And remember, I said if that's the case, they need to have those surgically opened so that the brain can develop normally. Malformations associated with brain development, microcephaly, true or primary microcephaly, secondary or acquired microcephaly. Remember, in medicine, anytime you see secondary, it's occurring because of something else. There's cortical dysplasia, congenital hydrocephalus, Dandy-Walker malformation, and this is something I'd keep in mind because it's got a name attached to it, right? Dandy-Walker syndrome is a very rare group of congenital brain malformations, and there are 3 subtypes which affect multiple organs to varying degrees. Encephalopathies, static encephalopathies, cerebral palsy is an example of that, and there are different levels of cerebral palsy, and they're listed here. Encephalopathies continued, inherited metabolic disorders. There are different disorders that children present with at birth. One of them is called PKU, phenylketonuria, and this is one of the blood tests that the baby is checked for at about 24 hours of age. So this is a standard. All babies are tested for a series of metabolic disorders before discharge. And the thing with PKU is it's amino acid metabolism issue. Their body cannot metabolize certain amino acids, and as long as they avoid them, they're fine. But if they are exposed to them, they will end up with permanent brain damage. So dietary restrictions are very important. I had a patient once years ago whose baby was born with PKU, and the mother was not compliant to the point where she actually lost custody of the child. And the father became the primary custodial parent because she was not being compliant to the diet. Different storage diseases are lysosomal storage and Tay-Sachs disease. Now here is a graph, an algorithm that describes phenylketonuria, but I wouldn't spend a great deal of time memorizing that. Other encephalopathies are intoxications, as in lead poisoning, infections, such as meningitis, and there are 3 different types: aseptic, bacterial, and viral meningitis. Cerebral vascular disease, perinatal strokes. Uh, this is a stroke that occurs in the fetus, so there is a disruption in blood to the brain while the fetus is in utero. There are childhood strokes also, just like in adults. There are ischemic, hemorrhagic, and moyamoya disease. Epilepsy in children is diagnosed when a child has more than one unprovoked seizure. And this was one of the case studies that was done and of a febrile seizure. There are different types of seizures: neurologic and systemic seizures. Febrile seizures are considered benign. However, they still have to be watched closely. Years ago, they used to automatically treat children with anti-seizure medicine if they had a febrile seizure. They no longer do that, but they do make great efforts to ensure that these children do not have high temperatures because they're sensitive to it. Childhood brain tumors, and these are the different types of brain tumors that there are: medulloblastoma, ependymyoma, cerebroastrocytoma, brainstem glioma, craniopharyngioma, and an optic nerve glioma. And here is where the different tumors originate in the brain. But again, I don't want you memorizing this. This is for your uh, education value, not to be memorized. Other childhood tumors are embryonal tumors like neuroblastoma, retinoblastoma, and these are tumors that are actually um, develop in the embryologic as the fetus is being developed. And this is what retinoblastoma occurs. Now this is a good picture here. I'm going to show you. See this? Where this is called the red reflex. And anytime you're examining a pediatric patient, newborn, one of the things you do is you're going to turn out the lights and you're going to take a light and you're going to shine it in the pupil. And you want to see this red reflex. If you don't see the red reflex, that is a sign that the child may have retinoblastoma, which is a tumor. And this tumor is, they generally have to remove the eye to treat the tumor, but it does have a very high rate of success if that's done. However, I have read some legal cases where this has actually been missed. So this is a practice that you want to ensure you do on any infant that you're seeing in the office. You need to have a documented red reflex on those patients. And that's the conclusion of our neurologic system on children.